So the standard at most radiation oncology places across the country has always been photons. And looking at ways of trying to deliver a more precise beam to improve the outcome of radiation and avoid some of the side effects, these proton centers have been popping up across the United States. And there's an advantage to protons biologically compared to photons in that it deposits the radiation right at the prostate, so theoretically is avoiding all of the normal tissues that you want to avoid. So, the problem with protons in the setting of prostate cancer is that there's never been any studies to show that they have an advantage over photons, because nowadays, with the type of equipment we have and the type of imaging we have on a daily basis, photon radiation has become so sophisticated that we're able to achieve the same results as protons, but not at the cost that the insurance companies don't want to pay, and not at the inconvenience that you would have of having to leave the state to get that type of treatment. So in our consultation, unless you're motivated to leave town for a long time and get treated elsewhere, I would say that there's no evidence in the literature to support protons over photons in the setting of prostate cancer. Protons are predominantly for pediatric patients when you're trying to avoid, spinal cord or brain tissue. So those are the most cases where protons have been shown to be advantageous.
And just to add to that, Beaumont Royal Oak is opening a proton center. I think they'll be finished this spring, and they are not going to be treating prostate. They, in the lines with what Dr. Maier said, is there's been no consistent advantage to justify the cost clinically, experimentally, to use protons for prostate. The program that's going to be developed at Beaumont is going to be primarily for brain tumors and pediatric cancers. So I think that says a lot that as a health organization, Beaumont is not going to be treating prostate cancer with proton beam therapy.
And nowadays, we have a hard enough time justifying photons for the insurance companies, and we have to go through paperwork on every single patient to show why we're treating, how many treatments we're giving. So the places with protons and the expenses are 5-6 times higher without any benefit are going to run into some trouble with that. And then the last treatment you touched on was neutrons, which is probably at one place in the United States right now, and they've shown in previous studies that for more aggressive prostate cancers, the higher Gleason scores, that photons in combination with neutrons may have an advantage. The problem with neutrons is they don't have the sophisticated level of imaging that we do with photons, meaning prostate can move a very small amount in its space in your body, and an important part of treatment is localizing that on a daily basis, pinpointing it, and radiating that. Without that technique in neutrons, you're apt to have more side effects, especially because neutrons are more powerful. So they're going to have more side effects without the possible good outcomes from the pinpointing of the prostate.